What do you do if you have a concussion? Very broad question. However, the first thing you want to figure out is if there are any red flags. So initially when a concussion happens, the thing that you should be most concerned with is not a concussion. The thing you should be most concerned with is something that's more serious. A more serious brain injury, bleeding in the brain, fracture of the skull, or swelling that may be happening in the brain. And these are accompanied by signs and symptoms that are what's called red flags. These things, when present, you should be going to the hospital immediately to get an image done, such as a CAT scan or CT scan, because that can look in the brain and detect bleeding, skull fractures, swelling, and things like that, okay? So the first thing you want to be concerned with if you do have a concussion or you think you might have a concussion are the red flag symptoms. Things that could indicate this are having a prolonged loss of consciousness. If you've had loss of consciousness for a minute to 2 minutes or more, I would probably be going to the hospital with that just to make sure there isn't something more serious. Post-traumatic amnesia, so meaning that if you still can't remember what happened, or you're still having the inability to form new memories, and this is mostly to an outside observer, a parent or a coach or somebody who's with an athlete or somebody who's just had a concussion, the athlete may keep asking the same questions like, why are we here? How did we get here? What happened? What happened in the game? And they keep asking these questions, and it's been more than an hour or two after injury. Take them to the hospital because that indicates that there's something maybe more serious going on. Slurred speech, numbness or tingling in the hands, feet, or face, some sort of neurological signs, weakness in the arms or legs as well, balance and coordination difficulties for more than 30 minutes after the injury. This type of stuff is all potentially normal within the first few minutes after injury. But if it's been about half an hour after and these things are still occurring, they're still very uncoordinated, still having balance difficulties, slurred speech, numbness, tingling, any of that stuff, you should be going to the hospital. If the person is still confused or disoriented after about 30 minutes, take him to the hospital. Okay, this stuff indicates those red flag issues that I was talking about, indicates the need for imaging, so they need to go to the hospital to get the image done. What do you do if you think you have a concussion and you don't have any of those more serious signs and symptoms? Let's say you just have a headache, or you feel a little bit dizzy, or feel a little bit off, but you don't have any of these things. One thing I forgot in the red flag is also vomiting. If you start vomiting, hospital. Okay, so if you don't have any of that and you just have typical concussion signs and symptoms, we've covered that in previous episodes, but they are the most common ones are headache, dizziness, nauseousness, a little bit of confusion, trouble concentrating, things like that. Those are the main ones for concussion. There's 22 signs and symptoms. You can always Google this. What are the symptoms of a concussion? If you have any of those ones and you don't have the red flags, well, the first thing you'd want to be doing is trying to make an appointment with a licensed healthcare practitioner who has training in concussion. The most important piece is the training in concussion. Most healthcare practitioners don't really have concussion education. It's not something that's been historically covered in healthcare curriculums. So a lot of the practitioners that are out there that don't typically see a lot of concussions may be using outdated information, and they may not really have a good understanding of what the best treatment protocols are for concussion at this current time. So the best thing you can do is try to find somebody that has training in concussion, and then try to get in there as early as possible. We have some research being done right now in partnership with McMaster University looking at data from our database system, which is connected to over 300 clinics around the world, and we find that the single most important factor for recovery from a concussion is if you are in to see one of our trained people within the first 5 days after the injury. From day 6 and beyond, it starts to go down. Each day you wait to see somebody at one of our clinics. So this is only specific to our clinics, but what we're finding is that if you come in within that first 5 days, your chances of recovery in a shorter duration is increased, and it's the single most important factor for a speedy recovery is seeing somebody within those first 5 days. After that, it's still very important, but each day you're behind, it decreases the likelihood of having a fast recovery. Okay. If you go to CompleteConcussions.com, you can find a complete concussion management trained healthcare provider in your area. I would start there first. If you can't find one of those, I would be Googling, for concussion clinics and things like that, and try to look for ones that have an evidence-based approach. Okay, there's a lot of crazy fads out there that don't necessarily have any scientific evidence to support their use. So just a lot of anecdotal stuff. Look for evidence-based, look for somebody with experience, talk to your friends and colleagues and stuff like that. Everyone knows somebody that's had a concussion, and they may have good resources in the community for you for that. But the trick is getting in early. A lot of healthcare practitioners may give you the wrong advice, so if you can find the right one, they can set you on the path for success. Okay? So in summary, what do you do if you have a concussion? Well, first, if you have any red flag issues, go to the hospital immediately. If you're concerned, go to the hospital. You'll never be wrong in going to the hospital. If you don't have any red flags, you just have typical concussion signs and symptoms, start calling around, find the the best concussion clinic you can find in the area. CompleteConcussions.com has a whole list of them. There's a map that geolocates to your area. You should be able to find one in your area, in most places anyway. And if you can't find that, I would try to look elsewhere, talk to your friends, colleagues, everything. Getting in quick is the key. 5 days. Okay.